Uh, the Indian perspective that I'm going to be talking about today is everybody is aware of it. It's just that some data I have compiled, and this is not a topic which can be actually taken care of by just one person. Today, all of us here are together. We have had one special session we have kept only to identify the challenges. Whatever is good, we don't really need to, we can only improve on that. But whatever is missing, whatever is a gap, we need to really brainstorm, come out with solutions and implement them, because implementation is the key to everything. If we just discuss and we go home and go back and do the same thing, it really won't make any difference in this world. And we want to make a change. We want to make a difference in this world. So let me just touch upon what all this maybe I could discuss at some other time. Very briefly, I could just say that we started off as a surgical oncology section of Indian Association of Pediatric Surgeons, specialty section in 2006. And in 2018, the section was registered with the Charity Commissioner. The constitution and bylaws were formed, a new PAN card, new bank account, all of it was done. And we had the first annual conference, first annual dedicated conference of surgical oncology section, that is the SOSCON. It was held in Goa in 2018. Followed by that, we are having routinely conferences. And in 2024, we are here today with a membership strength which is more than 300, and we have had significant strides which we have made. But yes, we need to identify the gaps, the challenges, and how to move forward. So there has been a publication in 2023 itself, very recent, where an assessment of the childhood cancer care services in India has been done. There have been like so many authors to this publication. So these are excerpts from the publication. So they mentioned that in 1960s, the first pediatric oncology unit was started, and later on it increased from 1980 onwards. And a national survey of these services was conducted in 1988, and it was observed that around 50% of the cases were handled by the pediatric oncologists. And has the situation changed today? Not much, to be honest, but we really don't have an exact data, because such surveys and such studies are very difficult to conduct, first of all. And secondly, the participation is scanty as well as scattered. It's not uniform across the country. So they have conducted a survey with the inclusion of 137 tertiary level and 92 secondary level hospitals in 26 states and 4 union territories. Public and private care hospitals were all included. So they have done descriptive statistics, which was used to primarily present the health service status and data. They found that a dedicated pediatric oncology department was available in only 41.6% of the public hospitals, only 48.6% of private hospitals, and 64% NGO managed tertiary level hospitals. And in 39% of the 92 hospitals providing secondary care, childhood cancer care was provided. There are a lot of other data that we have, like availability of diagnostic facilities, like bone scan was available in 41.5%, PET scans were available in 25.9%, and this figure was lower in public tertiary hospitals. Histopathology, CT scan, MRI were lower in public secondary hospitals than in private and NGO managed hospitals for the corresponding level of care. And most of the tertiary hospitals had the required supportive care facilities, except for play therapy and hospice care. So generally, most of the Indian setups do not have that. Some of them do have it, even in public setups. Less than 50% of the public tertiary hospital had stocks of the 4 categories of cancer treating drugs and essential infrastructure of radiotherapy and chemotherapy. And most of these secondary level hospitals not treating the childhood cancer had referral linkages with tertiary hospitals. Following the analysis, it showed that the concentration of availability of childhood cancer care services were at the tertiary level of healthcare. There were gaps in the availability of specialized pediatric oncology care in all tertiary hospitals. The availability of childhood cancer care services were higher in private and NGO managed hospitals than in the public hospitals. Integration of this as a national cancer control response should be taken up as a matter of priority. And to formulate childhood cancer policies that will enable timely access to care universally. So they also have published some data according to the National Cancer Registry Program and the report in India, and also the Ministry of Health and Family Welfare National Program for Prevention and Control of Non-Communicable Diseases. The entire article, you can always read it up. I can provide you the link or put it up in the APSOCON group. So realizing that there are issues that we need to deal with so that we improve our Indian status and the outcomes. We have also a publication earlier by Dr. Ramandeep Arora, I guess. I don't remember which year, but he has published that the outcome of 5-year survival, tumor-free survival is just about 50 to 60%. In India versus countries abroad where it is 80% and above. So looking just at this figure, we know that we need to do something more than what we are doing so that things can be better. So our APSO team and our executive committee members from the 5 zones of the country of India, Dr. Manoj Joshi from the central zone, Dr. Prabodh Goyal, Dr. Monica Bhagat, West Zone, Dr. Prabodh from the North Zone, Dr. Senthil Nathan from the South Zone, and Dr. Santosh Mahalik from the East Zone. All of these 5 executive committee members have collated some data from centers who agreed to be part of this survey. So somewhere around 30 hospitals have participated overall. And we have found, I have compiled the outcome of all the problems that they have faced. So the first thing which really struck us, which we know already, was that there have been delayed presentation, and even after presentation, there has been a delay in diagnosis. So by the time actually the patient comes for treatment, he is already in advanced stage. And once this entire diagnosis is made, then comes the question of, okay, how long will be the treatment? What will be the finances? Whether the patient will be able to afford. Affordability here becomes a major challenge, especially when it is a girl child. And this has been noted all across the country, individual institutes as well. I'm sure all of y'all will come up with so many stories like these. And then once the treatment, if we overcome all these challenges and we treat the patient, then there is a poor follow-up. So this is one thing which we really, really need to tackle. So once we actually, we will have to formulate strategies to do this as well, because it's not at the level of the pediatric surgeons only. There are multiple areas which we will need to touch upon. The another major deficiency is lack of specialty pediatric services. I mean to say the pediatric oncologists are lacking in many institutes, wherein the pediatric surgeons themselves are giving chemotherapy, or maybe the radiotherapist is giving chemotherapy. Something like this is happening, or maybe the adult oncologist is giving chemotherapy to the pediatric patients, meaning some interim solutions are being done. Pediatric oncopathologists are not there enough. Pediatric radiodiagnosis or radiologists, oncoradiologists are not enough in all centers. Pediatric radiation oncologists, that is another very major part where there is deficiency in almost all centers across India. Few centers do have, but only few centers have. Then it was also found that we have deficiency of multidisciplinary care team within the hospital, which means that if the patient goes to a surgeon, the surgeon treats the patient without having a multidisciplinary approach. As I mentioned earlier, we need to have an ecosystem. A patient with a malignant tumor is a part of the ecosystem. A pediatric is the main center actually of the ecosystem. Pediatric surgeon is one part of the ecosystem. He is not the whole and soul to manage the patients. Pediatric oncologist plays its own role. So there are several parts, 7 to 8 parts of this ecosystem, and all of it need to be in place. How many institutes in India have this? Not many, right? So this is also we need to work on. Then there have been some recommendations from this survey that we should have a nationwide funding system. I'm not sure whether how much we can do on this aspect, but we can, as APSO, maybe we can brainstorm and look at what options do we create for patients all over the country who are poor. There are patients, poor patients who have facilities in government hospitals, which is totally free of cost. But not everybody can avail of those facilities, and not everybody has an access to those. So maybe we can look at this as well for improving the care of children with solid tumors. And then most important, we really do not know what is happening where. So we need to have a national tumor registry. We also need to have the surgical guidelines, as Professor Chan mentioned, and we need to have our data in place. So somebody has to do this. Now, who will do this is what we have to come at a conclusion by the end of this day. But this is what I found. I'm sure I've missed out quite a few other issues which are probably as significant, which we come across on a daily basis. But I found these to be the main things which will really impact on the final outcome of children with cancer. Thank you so much.